As most of you know, the Supreme Court of the United States ruled the constitutionality of the Affordable Care Act. What it also did was give states the authority to expand Medicaid. In this state and across this country, some Republican governors and legislators have strongly suggested or have declared that their state would not expand Medicaid, and that they are still fighting on a political battle the effort to expand health care to all Americans. What is expanded Medicaid? And let me be clear that this is a voluntary program that states can participate in. And that's why it's important for this state to engage in this conversation now. Expanded Medicaid will allow Iowa to expand its health insurance program, Medicaid, to about 182,000 Iowans. And for the first 3 years, the federal government will pick up all of the cost. And over the next 8 years, that cost will be shared with the state to a point where the federal government picks up 90% and the state will pick up 10%. Why is this important for all Iowans? And why will this help all Iowans? Well, most of you know that uncompensated care for this population is extraordinarily expensive. They go to emergency rooms, or they don't get care at all, and when they have a chronic disease, it's even that much more expensive for them to get treated. In Iowa, the Hospital Association has estimated that the uncompensated care is $851 million. When you have expanded Medicaid, and that allows for those costs to be shifted from uncompensated care to an insurance program, then all premiums will start to come down. Now, just an hour ago, the Department of Human Services released a report that we had asked them to accumulate information about the effects of expanding Medicaid to this population in 2010. They released their first, they didn't release, they had a first draft in March of 2011. This updated draft was to the point of December 2011, 8 months ago. In that report, it states clearly that expanding Medicaid for Iowans is both affordable and sustainable. That if you were to take the 182,000 Iowans, provide them Medicaid at the same level as that Iowans receive it now, under the formula that the United States will pick up 90% and Iowa picks up 10%, it will cost the state $161 a person per year. Now let me repeat that. It will cost Iowa $161 per person per year to put 182,000 Iowans on Medicaid. That supports our claim that it is affordable and sustainable, and it contradicts the governor's assertion that Iowa can't afford it. We think that the governor now should reverse his position. But that's not the most troubling part of the politics of today. When this election is over, the most troublesome problem will be with state legislators. Because you see, the legislature has to take affirmative action to expand Medicaid. And it has to be signed by the governor. He can't do it alone. It's going to take cooperation. And in this state, we have had good cooperation when it's come to health care. The insistence that we don't expand Medicaid is the first time that that cooperation has been suspended. But we think that the real problem is going to come after the election. We had two state senators, the Republican minority leader, Jerry Bain, and the Republican minority whip, Brad Zahn, proposed legislation in the last session, Senate File 111, where they would kick off 26,000 kids from Hawkeye, the children's health insurance program. Now, if they're willing to propose legislation to kick kids off of health care, what do you think the likelihood is that they will want to expand Medicaid? So we have to understand that we've got a responsibility today to look at the facts that the report has been issued from the governor's own department. And as that report states, it is not only good for the people who will be the recipient of the expanded Medicaid, but it will be wonderful for the entire state as well. Now I'll be very willing to answer any of your questions.
You know, I guess my first question is, with the governor being on the other side of this issue, how much of a reality do you believe that it'll come true for Iowa?
Well, the governor cannot do this alone. He cannot reject expansion of Medicaid. It takes a legislative initiative. And I think the evidence is so overwhelming that not to expand Medicaid and leave close to $5 billion on the table over the next 8 years is financially irresponsible. With that kind of evidence that his own department is presenting in the report that I issued, that I released today, he really does not have a choice, and I believe the governor will see that. I mean, the governor is the administrative head of the state. He's the CEO of the state. That is too big of a number to leave off the table. My concern is the legislature, who feels more about their personal political ideology than the affairs of the state, and certainly the concerns of individual Iowans. That's my real concern.